All right, good afternoon, everybody. Okay, good afternoon, Queensland. So we have some more good news today. I can report that we have 0 new cases, so that's excellent news. And we have had 5,718 tests in the past 24 hours, and 14,920 vaccines were done by Queensland Health yesterday. Now, how good was Bunnings? I mean, that was absolutely fantastic. So well done for everyone who came out. In total, there were 7,922 people got their vaccine. And I want to see, hopefully, more Bunnings this weekend, because obviously people are more than happy to come and get their vaccines there. So, as of today, we have 72.26% of Queenslanders have at least one dose, and 56.58% are now fully vaccinated. So, can I just say that Cabinet has had a very good meeting today, and we want to update Queensland about a few issues that I think will see the possibility of families being able to reunite in time for Christmas. Now, it's going to be really important that Queenslanders do one thing, and that is to get vaccinated. I cannot stress the imperative to getting vaccinated, because there is going to be a risk of Delta outbreaks happening in Queensland, and we need to be prepared. I can say that in Brisbane, the vaccination rates are much higher than in regional Queensland, and we are one state. So we need the vaccination rates to increase right across the state. To that end, I'll be sending my ministers out to the length and breadth of Queensland this week, urging those people who are not vaccinated to get vaccinated. We're all in this together. If we're going to weather this storm, think about it in terms of how we deal with natural disasters. If we're going to weather this storm, we can be so prepared for this storm if we get vaccinated now. So I'm urging Queenslanders, this is your last opportunity. This is your last chance to get vaccinated. Minister Grace is going to be looking at how we can get the vaccines into schools during school hours so the kids can get vaccinated, that 12 to 15-year-old age group. We're looking at Bunnings, but it is absolutely imperative that people get vaccinated. We have always had a measured and cautious approach, and Queenslanders have done such a great job. I think, we're the envy of not just other parts of Australia, but I think, in other parts of the world. People were shocked when I was over in Tokyo, being able to tell them that we have been able to weather the Delta storm. But we know that the world is a big place, and there are families across Australia, and there are families across the world. And people have been telling me how they miss seeing their uncles, their aunts, their mothers, their fathers, their children. This is really important that we unite Queenslanders, but we do it in the safest way. So we are going to try and minimise the risk, and there's a couple of key steps that we'll take along this path. And don't forget too, because we've had that strong health response, our economy has been booming, and the Treasurer will talk a little bit about that, and we want to see that continue into the future. So my job as Premier is to keep Queenslanders safe, and the way I can help protect you is for you now to go and protect yourself by getting vaccinated. It is absolutely critical. So what does that mean? Well, today I'm releasing our Queensland's COVID vaccine plan. It's a measured and cautious plan that will do what we want to do, reunite families and protect Queensland from Delta. It sets out dates when we expect to achieve 70% and 80% of eligible Queenslanders who are fully vaccinated. And if we keep getting vaccinated, we'll be able to welcome family and friends from interstate hotspots in a little over a month who are fully vaccinated. And a month after that, in December, they'll be able to come without having to quarantine in time for Christmas, but they too will need to be fully vaccinated. And I think Queenslanders would acknowledge that that is a sensible and cautious approach to ensure that families can be reunited, but the people coming into Queensland will have to be fully vaccinated. So the faster we are vaccinated, the faster these deadlines will be achieved. So it does mean that some of these dates may come forward if we get the vaccination rates up. So if we reach 70% sooner than November 19, we will ease the restrictions sooner. And if you are fully vaccinated, you are 86% less likely to catch COVID and pass it on. And Dr. Young will talk a little bit more about that. So I'll just run through it. So at 70% of Queensland's eligible population fully vaccinated is expected on November the 19th. So if you are coming from a declared domestic hotspot, so that's like New South Wales or Victoria, in the previous 14 days you can travel into Queensland provided that you are fully vaccinated and you arrive by air and have a negative COVID test in the previous 72 hours, and you'll have to undertake home quarantine for 14 days. Now that changes because it's going to be a lot safer for Queenslanders when we are 80% fully vaccinated, and that fits in with the national plan as well. And we've done modelling to look at all of this as well, so Yvette will speak to a little bit about that modelling. But at 80% of Queensland's eligible population fully vaccinated expected on December 17, travellers from an interstate hotspot can arrive by road or by air. They must be fully vaccinated, they must have a negative COVID test in the previous 72 hours, and no quarantine will be required. So that is good news for families to be reunited for Christmas. And of course that December 17 may come sooner if we reach those thresholds sooner. So it's up to Queenslanders. It's definitely up to Queenslanders. So some very good news today, and I'll hand over to the Deputy Premier to say a few words, and then you'll hear from the Chief Health Officer, the Health Minister and the Treasurer, and then we're happy to take some questions.
Well, today the Premier is doing exactly what Queenslanders have learned to expect from her, as she has always done throughout this entire pandemic. She is outlining to Queenslanders a measured, cautious and safe approach, one that is informed by the best health advice, one that puts the safety and health of Queenslanders and our economic interests first. It is based on the best advice and the best available modelling. It is not a series of reckless decisions as we've seen from New South Wales. We will not give up on having a plan as the Prime Minister has. Queenslanders, we can do this, and we can do it with a plan. When the vaccine arrived, we said it was the beginning of the end, and this is a plan to finish vaccinating Queenslanders, a plan to bring families back together, a plan to get us moving around again and start welcoming people to our state again. It's also a plan that begins to set a deadline for Queenslanders to get vaccinated before we expect COVID to start arriving here, the 17th of December. There have already been lots of good reasons to get vaccinated. So you don't get the virus, so you don't get as sick, or you're less likely to get the virus, less likely to get sick, less likely to pass it on to somebody that you love. But this plan gives you even more reasons to get vaccinated. If you want to move around more, travel around more after the 17th of December, get vaccinated now. If you want your family to visit for Christmas, get vaccinated now. If you want to avoid regionalised lockdowns and restrictions, get vaccinated now, and that's particularly important in those regions where their vaccination rate has been lagging. We're also saying that after that 17th of December, when we expect to meet the 80% of the eligible population double vaccinated, there will be other freedoms that are only available to people who've been vaccinated. We will work with industry and business, but we expect that there will be some settings and venues that decide to be vaccinated only, and in return they will have eased restrictions. So there are venues that you can go to now if you're unvaccinated that you won't be able to go to after the 17th of December. And if you want to continue to go to those venues and businesses that may choose to be vaccinated only, then get vaccinated now. And finally, if you want it to be sooner than the 17th of December, get vaccinated now. And if we meet those targets sooner, we'll be able to bring forward those timeframes.
Thank you, Premier. So, no new cases in Queensland overnight, which is fantastic, and we do not have any active clusters today in Queensland. So the most important thing now is we have a time frame to aim for, the 17th of December, which means the latest people can get vaccinated and be protected is 6 weeks before then, and we might even get there earlier. And the most important thing every single Queenslander 12 years of age or older needs to do is protect themselves, because once we start seeing cases, this virus will find people who aren't vaccinated. We know that you are very protected if you're vaccinated. So we now have a deadline. That's the 17th of December. Hopefully it'll happen even earlier than that, because I know people want to get out and about. And now I make a plea to younger people. If younger people were to get vaccinated, we would reach that target even earlier. It's younger people in that 20 to 39 year age group who probably feel they're invincible, but you're not. You need to get vaccinated so we can return to a normal way of life. Thank you.
Well, from day one, we had a plan to suppress the virus in our communities, to ensure that we kept our death rates and our positive cases as low as we possibly could until our population was vaccinated. And Queenslanders, you have done an incredible job. We are in a far better position than many other jurisdictions in Australia and globally. And that's because everyone has done the right thing when they've been asked to do it. Because we've had the short lockdowns, because we've had the restrictions, we've complied with the mask wearing, we've kept the social distancing and the good hygiene. And that has put us in the best possible position to now be able to transition into living with COVID in a safe and responsible way. In New South Wales, when their outbreak happened on the 16th of June, only 4% of their population was fully vaccinated. In Victoria, when their outbreak happened recently, they were only 20% fully vaccinated. We are already over 50% fully vaccinated, and we will allow people to travel interstate and come back without quarantining if you're fully vaccinated with a negative test, because of all the great work that everyone's done once we get to that 80% mark. Now, Dr. Young just said our young people can help us achieve this. Over 584,000 people between the age of 20 to 39 in Queensland right now are unvaccinated. This is around 15% of our eligible population. If those 584,000 people come out this week to get vaccinated, you can open up Queensland to Australia. It is in your hands. You can decide whether people get to go visit loved ones in New South Wales and Victoria and the ACT and come back without quarantining. They're fully vaccinated and, of course, they've had that negative test. It is in your hands. But we also want to make sure that our regions do not suffer as we open up. So we need our regions to equally come out and get vaccinated in big numbers to also hit this 80% target and beyond. Now, we have the modelling and we know what the worst case scenarios are, and we know that we can manage this virus in those scenarios because of how well we have done so far. But we have to have those vaccination rates at that 70, 80, 90%. The more we vaccinate, the less pressure we put on our hospital system. Now, we have modelled and we have planned for this to occur and manage our health system going forward. Our health system will manage extra people coming into our hospitals and our ICUs. That will absolutely happen. We know it will, because everyone will be exposed to this virus at some point. And those numbers will climb over coming months and they will stay high for a number of months. But how high they get is up to Queenslanders. And we can do the modelling and make sure we are planning for the beds in the ICU and the staff being trained and manage this. But we can't control where it happens. If it's in Mount Isa, if it's in Cloncurry, if it's on the Gold Coast, if it's in Mackay. That is up to the people in those communities how hard it hits your community and what targeted restrictions we will have to put in place for you because of your vaccination rates. So there is one thing every single Queenslander can do today to help us deliver on this plan and do it even quicker, and that is getting vaccinated.
For almost 600 days, for nearly 2 years, we have kept the virus out of Queensland. Those days will soon come to an end. This will be the end of zero COVID for Queensland. But it's also a great day for Queensland. It is a great day as we prepare for our future. If we can get this job done, we can show the world how to handle a pandemic. If we can get this job done with as little death and little illness as possible, if we can get this job done with as little economic devastation or damage as possible, then this will be of generational benefit to Queensland. It will set us up. It will set us up for the golden Olympic decade and beyond. But this is the final hurdle, and I know Queenslanders working together can get across that challenge. This is a call today. Today we're calling on Queenslanders. Today is a call to arms and a call for arms. We need to get Queenslanders vaccinated, and the single biggest way to get ready for the future is to get vaccinated, and to get vaccinated today. Unvaccinated people are 29 times more likely to end up in hospital than vaccinated people. Vaccinated people are 86% less likely to contract COVID and pass it on to someone else, particularly someone that they love. As we heard from Victoria yesterday, 90% of people in Victorian hospitals with COVID were unvaccinated, and 97% of people in intensive care had not been vaccinated. Do not live with regret. There is no time to waste at all. Get vaccinated today. As Treasurer, my message to Queensland businesses is that it is great news. It is great news that our borders will soon be reopening. When our borders reopen at 80% double dose, that will mean an annual net benefit of $1.5 billion for our domestic economy, particularly for sectors like tourism, hospitality and entertainment. But my warning to business is clear. My warning to business is this. On the 17th of December, when we get to 80% double dose, the Morrison government has made it abundantly clear that financial support will disappear for businesses and income support will disappear. That's a decision the Morrison government made. There wasn't a national cabinet decision. It wasn't a decision made with the states. They will be turning off business support and income support when Queensland gets to 80% double dose vaccination. They've said that time and time again, and there's absolutely no way that we can afford in Queensland to fill that gap. We pleaded with Josh Frydenberg, the Federal Treasurer, and Scott Morrison to continue with a form of tailored and targeted JobKeeper. They refused. So once we reach 80% double dose, there will be no financial support, even if your particular community has to go into lockdown or restrictions have to apply. So if you live in regional Queensland and there is an outbreak and necessary movement restrictions are put in place, or a lockdown has to, in a worst case scenario, be put in place, because your vaccination rate is stuck at 65 or 70%, then there will be no financial support available. I make the same message to the people of Logan today. Our vaccination rate in Logan is far too low. It must accelerate as quickly as possible. People in the community where I live, the community that I love, must get vaccinated as quickly as possible. Otherwise, you will face necessary restrictions without any financial support. So my message to business today is clear. Please do everything you can to ensure that your staff, your patrons and your customers, but also your community, gets fully vaccinated as quickly as possible to avoid the need for restrictions or any possible lockdown.
Do we have any sort of modelling done as to how many people might be sick with COVID once we get to overdose?
Yes, we've got all that modelling. Dr. Young can talk to that, and we're more than happy to release that because we think Queenslanders should see that modelling. There's a second piece of modelling that was supposed to come to National Cabinet, I think around this weekend. We still have not seen that additional modelling, so we're happy to release our modelling, and I'm urging the federal government to release the full Doherty modelling as well. I think the more information the public has, the better, because it is real. We are going to see cases where we haven't seen large number of cases before. We will see people end up in hospital. but we can prevent and minimise the risk by people getting vaccinated. That's why we are in a unique opportunity here in Queensland, because, like I said, we have this magical window of opportunity to get people vaccinated, and now there is a sense of urgency. I understand how difficult it is for families and friends not to be together. And if we want to reunite families, it's up to each and every one of us to go and get vaccinated. My whole family is vaccinated. I'm quite sure many of you have your whole family vaccinated. But Brisbane at the moment is not the problem, because Brisbane vaccination rates are really good. They are really high. But as soon as you get to areas like Logan, Ipswich, the Scenic Rim, Central Queensland, Mount Isa, the Deputy Premier is going to Mount Isa tomorrow, some of our Cape communities, I've got ministers going into those communities this week as well, Central Queensland, Gladstone, Rockhampton, Mackay, Whitsunday. And what's been hindering some of this progress has been the likes of George Christensen demanding people to not get vaccinated. Can I say to you, vaccination is the key. Vaccination saves lives. So I'm urging everyone in Queensland to get vaccinated. You'll be seeing me talk about this every single day this week. You will see my ministers talking about this every single day this week, and I'm urging every member of Parliament to be out there talking about that every day this week.
And just to clarify, so those areas that have lower vaccination rates will still face lockdown when the state average hits 80% of
They may, because what we will have to do, if we have an outbreak, a big outbreak, for example, it could be in Central Queensland, they may have to go into a lockdown. Then they will be on restrictions and there will be no federal government support. So it is urgent that we get our vaccination rates up right across the board. Now, Queensland is very different to New South Wales and Victoria. We are very decentralised. We have so many communities, and, you know, so many communities have done the right thing. After this, I'll be speaking with a whole lot of mayors. We'll be talking to industry this afternoon. We'll be speaking to tourism operators as well, the tourism industry people. This is going to need everybody encouraging people to get vaccinated. And can I say to the tourism operators as well, you know, we want to see your industry boom as well, but the Gold Coast and Cairns and Mackay and Whitsunday, they need to lift their vaccination rates if you want tourism to come into those regions. It is absolutely imperative.
You say these targets could be reached earlier, but we could
Yes.
also reach them later, in which case that December 17 Christmas
That
date
December
is in
17 is
order,
locked in. We have to give certainty, and that's locked in.
even if we're not at 80%.
Absolutely, it is locked in now, and I'm quite confident because, you know, we are going to drive this and make sure that people get vaccinated. We're going to do whatever it takes to get people
If we're not
vaccinated.
at 80% by December 17, it's still...
We have to go ahead.
Premier, do you regret not releasing this earlier?
No, not at all, not at all,
Shouldn't it
because.
have been earlier to get people moving?
No, I think what you have to realise, and that's a really good question, Claire, but let me talk about this for a moment. In New South Wales and Victoria, there has been a sense of urgency to get vaccinated because they had widespread Delta outbreak. They've had people in their hospitals, they've had people in their homes who have been very ill with COVID, and that has been an incentive to get their life back to some form of normality. I'm asking Queenslanders to get vaccinated so we can keep our sense of lifestyle.
Why do you
Why
say
would you,
we
Premier,
have to
why
go
would
ahead?
you-
Why do you say we have to go ahead on December 17 regardless of 80%?
Well, we have to reunite families. This is fundamental. We have to reunite families. And like I said to you, in Brisbane, those rates are almost nearly achieved, right? That's where most of the population is. But I want to drive this right across the state. It is so important now more than ever for our regional populations to get vaccinated.
I mean, why would you be prepared to lock in though the 17th, given all the concerns you've raised about, say, children under 12 being unvaccinated, the hospital capacity? Why would you be prepared
Yeah, I can
to
talk
lock in
about
the
all that too.
17th no matter
So
what?
first of all, the federal government has addressed the need for boosters, and that was part of the national plan, so they have satisfied that. Secondly, the health minister and all the other health ministers have written to the federal government asking for more money for surge capacity. I still think that is needed, so they are conversations that will still be had. And in relation to children, something I'm very passionate about, and mothers stop me and talk to me about that all the time. They spoke to me about it just this weekend as well. We already know that ATAGI is looking at that in terms of the advice, and there is some moves for immunocompromised children to get that vaccine. So that has been somewhat alleviated, but we do need to get the 12 and 15-year-olds vaccinated, and like the Health Minister said, we do need to get young people to get vaccinated. And I think it's a pretty good motivator if you want to enjoy the freedoms you've got now to go and get vaccinated, or if you want to go and see friends and family in other states.
If you don't have to lock down places like Central Queensland, for example, would there be different rules for if you're vaccinated or if you're not vaccinated in that scenario?
That's up to business, so we'll be speaking with business, but they may impose their own restrictions.
But if you put a community into lockdown, would everyone have to be in lockdown, or would it just be the people not vaccinated?
Well, that would depend. I mean, it would depend on how widespread. We'd have to get the advice of the Chief Health
What
Officer.
about the lockdowns in terms of the general community, like Brisbane, say, once it reaches these targets, is that an end to lockdowns in Brisbane once we get to, say, double dose 70%?
Well, I think we're seeing the real live experiment happening now in New South Wales. So they are getting really good vaccination rates. So people say to me, you talk about 90%. Well, we're already seeing 90% in the ACT, we're seeing 90% first dose in New South Wales. You know, if we had this Australia-wide, I think Australia would be the envy of the world.
But it's got to be 70%, 80% across the state, right? It's got to be a state figure, not just a regional Brisbane figure.
Correct, it's a state figure, it's not a regional figure. Correct.
Just to be clear on that lockdown issue. So
Yes.
Once we hit 70% double dose in Brisbane, there is a possibility we could still see lockdowns.
Well, in the national plan, there is the ability to have targeted specific. So it might be, for example, say there was an outbreak in Logan, we may say there's that particular area in Logan. But let's just see how we're going at the moment. It's about getting the vaccination rates up, and we haven't had to do a lockdown for quite some considerable time now.
Do you think the
Yeah.
need for regional quarantines become redundant now that international...
No,
travel
not at
won't
all,
have to be
because there's
vaccinated?
still international students that need to come in, seasonal workers. There's still travellers that may be unvaccinated who come in, and they'll need to do the full quarantine.
So do you think at the start of the year there'll be no more hotel quarantine and it'll just be these regional centre at Pinkenbar and Wellcamp that are used?
No, there'll still be regional quarantine facilities needed.
And just one more, the eligible population, is that over 16s or over 12s?
It's over 16s, but we want to get that 12 to 15-year-old group, because if you have an outbreak, it'll spread in children, and especially if there are unvaccinated people in that group, it puts a lot of people at risk. So we're getting...
12-year-olds, do they have to quarantine still? So, you know, you're 70%.
No, I don't think so.
They're not part of that?
12 to 15-year-olds.
So if you're 12 to 15, can you be unvaccinated and still be able to do the things like here?
No, you need to be vaccinated to travel
To
to the state.
Sorry, how person travels into the state with a 3-year-old who can't be vaccinated?
As long as the parents are vaccinated
Yes.
and they've had an evidence.
Yeah.
What other measures is communities are going to face any additional, given that they could be vulnerable?
Look, we've got ministers going up there. We acknowledge that our First Nations people are more vulnerable, which is why we are driving a vaccination blitz into those communities. I've got ministers going into, my understanding, Pomperau, Arakoon, Torres Strait this week.
And what's the reality of, say, someone contracts COVID?
And Yarrabah, and Yarrabah.
What's the reality of someone contracts COVID in a regional states like Central Queensland? Would they, and we've been told by Brisbane hospitals that they won't take mass patient transfers. Will they be treated?
We've always transferred people. We have not had a problem with that. But this is the pandemic of the unvaccinated. So if you are living in a regional city and there are low vaccination rates, the virus will spread rapidly. So that is why you need to get vaccinated as quickly as possible.
What is the modelling for the worst case scenario with the surge in patients? What does that?
I can get Dr. Arnold.
Thank you.
Yeah.
Just quickly, Tammy, what about
Yeah.
the border? Does it mean anything for border residents? When can they cross without any restrictions at all?
The border communities. We'll look at that over the next, up until the date in November, just to see how those regional rates are going in New South Wales. But like I said, it's very encouraging, the high vaccination rates in New South Wales, the high vaccination rates that we're seeing in Victoria. But because they've had an outbreak, that is why people have gone and got vaccinated. We haven't had those mass outbreaks. So now it is more urgent than ever. If people want to see their families and loved ones and friends for Christmas, they all need to go and get vaccinated.
Harry, do you still anticipate wellcare to need 1,000 beds?
Oh yes, yep.
Could I just address the modelling data? So QIMR Berghofer has done some extensive modelling for the Department of Health, looking at all of the variables going forward. They've used the Burnett Institute methodology, so that's different to the Doherty modelling, and they've looked at worst case scenario, which is always very helpful. And with that worst case scenario, Queensland Health will be able to manage the case numbers and the ICU numbers within our capacity. Having said that, I of course would prefer that we don't have people in ICU for what is essentially preventable.
Do you have an idea of how many cases we might get as we open up?
So worst case scenario, we would start to see towards the peak, which wouldn't be till later next year, we might see up to 1,200 a day. But I very much doubt that, because that is absolutely worst case scenario without putting any mitigating factors in place.
Is that with 80% vaccination?
That's with different, so looking at 70%, 80%, 90%. So it's really detailed modelling, and you should look at it when it's released.
What are the ICU rates?
So again, I do not believe we would get to it, but it was very reassuring because it would get up to 400 a day, and we can manage that. We can manage 400 people in our ICUs.
The Rural Doctors Association has previously raised concerns about the retrieval service being able to cope if there's a really big outbreak in outback Queensland. You know, how many planes there are. Are you confident it'll be able to cope?
I was confident we could cope at the start of the pandemic, and we didn't have anyone vaccinated then, and everyone was at risk. So I'm absolutely confident we would be able to cope with people vaccinated.
And if there are parts of the state that have low vaccination rates when the border reopens, do they just become ring-fenced and people won't be able to travel there? Or can people even travel to places if there's like 40%
It would depend, but what I really strongly am saying to everyone in Queensland is don't be the person who's not vaccinated, because you'll be the person who gets COVID. And we have seen deaths even in younger people. There is no need for that. We have got plenty of vaccine. They are very good vaccines, so just go and get vaccinated today. A pharmacy, a GP, one of our mass vaccination centres, we've got pop-up clinics everywhere. So there is really and truly no excuse. Every single Queenslander 12 years of age or older can get vaccinated today.
So just to clarify, that RTD modelling was looking at the capacity in the South East Queensland?
No, across the state. Across the state, yes. We have got very good ICUs across the state of Queensland because we are a decentralised state.
We've seen some stats come out about people in New South Wales, the percentage of people who are unvaccinated in ICU. Have you seen those figures?
Yes.
Can you give Queenslanders a guide of what those figures show?
Yeah, they show that it's very unlikely you will end up in ICU if you're fully vaccinated. You've got to remember that their outbreak started when only 4% of their population was double vaccinated. So you were going to see large numbers of people in ICU not vaccinated. The people in ICU who were double vaccinated tended to be people with significant other underlying medical conditions and were in that older, frail group.
Sorry, just on my question about whether communities would have to be ring-fenced, you said it depends. What does it depend on?
Well, it depends on their vaccination rates, it depends on how many cases they have, it depends on what their response is. I hope it doesn't happen. I hope they all get vaccinated so there is no need to stop any movement.
There are sort of cities across the state that are at 40% and if we open the border to New South Wales, people from New South Wales will be able to travel there, or they will be locked in?
No, they will be able to travel there. So they will see COVID. We're all going to be exposed to COVID, every single one of us. It's a very, very infectious disease, much more infectious than flu. And if you just think back in your own lives how often you've had flu, every single Queenslander will have had flu multiple times. You can't stop it. The same with COVID. The issue will be that if you're vaccinated, you probably won't even know you've got it, or you might have some very mild symptoms, and that's what you want.
With the hospital modelling, we've seen ramping in all year, really a huge amount of stress on our emergency departments. How are we going to ramp that up to be able to cope with this new demand?
So our hospitals have been planning for this since day one. They thought they were going to be facing this last March, April of last year. So they have all of those plans and they can ramp up. That's in place, and I have no concerns about
Specifically,
that.
what does that mean, they'll ramp up?
Right? They will ramp up their capacity. So we know that there's some work that can be delayed. So they'll make decisions about what work gets delayed. They will recruit more staff, and hopefully they'll have all of the staff from our vaccine clinics, because we'll be able to move that work into our pharmacies and our GPs who normally do that work. So they've already trained up a lot of additional staff to man vaccine clinics and testing clinics. So they'll be able to access those people. And they've also looked at where else they can expand. A lot of additional money has already gone into the health system, and that's been wisely used.
We've got to go.
I think the Deputy Premier talked about potentially having different restrictions if the business only allows vaccinated people. Can you talk more about that?
Well, at the moment, we've got very strict requirements for density limits, for instance. So perhaps we won't have those. If a business decides only to allow fully vaccinated people into their nightclub, for instance, those restrictions can be removed for that business. But that's something businesses need to think through, and I'm sure they will be.
How will we keep international arrival quarantine? Like, we're doing international quarantining, but won't people just fly through New South Wales and come through here to avoid that?
They did that when we opened up to New Zealand, so we're well practised at managing that, and we'll continue to manage that.
People normally just to avoid that loophole, they just fly to New South Wales and drive over the border.
We'll manage that, as we've done before.
There we go. Thank you.